If you are looking for the perfect exercise to not only strengthen your legs, but to improve your ankle, hip and knee mobility, then stick around. If you don't know who I am, my name is Marius Visser. I'm a biokineticist. I work in oncology and orthopedic rehabilitation, where I help people in pain, dysfunction and disability manage their health and fitness goals. And they all happen to be over the age of 50, 60, 70 and even 80. So again, if that sounds like you, you're in the right place. If you were to stop me in the street and say, Marius, what is the best exercise to strengthen my legs for over 60s? I would probably say something like, I don't know, there's so many different exercises to choose from and they're all good. But maybe the better question to ask is, why are your legs so weak? Could there be an orthopedic problem? Did you have a knee replacement done? Did you have a hip replacement done? Do you have any degenerative issues like osteoarthritis? Do you have any injuries? Did you have previous surgery? The list goes on and on and on. So for that reason, I'm going to show you one exercise today that will take care of a lot of issues, and it's also going to be used as a springboard to help strengthen any other leg exercises you might have. So let's kick off with the isometric squat. Now for the isometric squat, you need something that you can sit on that is a little bit lower than a chair. Anything from your normal chair height, you can start working with it all the way down, 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 down. Remember, at the end of the day, no matter how old you are, you should always try to be able to get into a flat-footed resting squat position. This is obviously the best way to strengthen your legs through its full range of motion, but I know it is difficult, sometimes even impossible for some people out there, especially if you had a knee replacement. But it should always remain your goal to get your knee to bend at least past 90 degrees into the range of round about 115 and 120 degrees. So having said that, we are going to sit down on a chair approximately 30 centimeters high. And for you to get into this position, I want you to sit up straight first, and then I want you to start shifting your heels as far back towards the step as possible until you feel your knees are starting to tighten up. That is where we are going to start doing our work first. Now, that's one thing, is to get your knees into that position. The second part is what we call the isometric squat, and how we're going to make these muscles contract quite strenuously around the joints for a few seconds, and then we're going to back off and we are going to go into it again. So the idea is to strengthen your joints at that, because this is the weakest angle of your knees right now, is when your knee is at full flexion for you. Everybody is different, but if you can only get to just past 90 degrees and it's already starting to feel tight around the knee joint, that is the weakest part of your knee. So you will find it almost impossible to stand up with your knee bent in that position. The goal is obviously to get you to stand up no matter what position you are in. But we first need to strengthen that angle. So we're getting your knee into the weakest position until they feel like nice and tight. And this is what we're going to do. You are going to use your hands to push you up off the step over onto your heels, and you're going to hold that contraction for 3 to 5 seconds, and then you're going to slow down back onto the box again, and then we're going to repeat that 5 times. So this is what we're going to be doing. So I've moved my knees into its full flexion, and my heels are as close as they can move to the box. I'm going to place my hands on the step, and then what I'm going to do is I'm going to lean forward, keeping my chest nice and straight, trying to keep that little bit of a hollowness in your back. And then you're going to shift over, lift a little bit, push down into the ground with your legs for 5, 4, 3, 2, 1, and then sit back down again. Don't move anything. We're going to repeat that another 4 more times. And go. 5, 4, 3, 2, 1, and relax. And I want you to really press down into the ground as if you are wanting to lift yourself up. And go. 1, 2, 3, 4, 5. Good. And relax. Let's go 2 more. And push down, lean forward, press down to the ground as hard as you can. 5, 4, 3, 2, 1. My legs are actually starting to shake. 1 more, and let's go. And 1, 2, 3, 4, and 5, and sit down. Okay, my legs are on fire, and that was just 5 times 5 seconds. So what that does is we're making the muscles contract. It's called maximal voluntary isometric contraction. So now you should find a little bit more range in your knee. So you can actually move either your heels back to the box, or you can move your bum slightly more towards the edge of the seat. And then you're going to feel, okay, it's tightened up again. But you've gained a little bit of more range, and that's exactly what we want. Now we repeat again. Lean forward, chest nice and high, press down, lean forward, press down through the floor. 5, 4, 3, 2, 1, and back down again. You might feel a little bit of discomfort in the knees, especially if you had a knee replacement done, or you've got some osteoarthritis inside the joint itself. Okay, so let's go for another 3 more. 1, 2, 3, 4, press down nice and hard, and 5, and slowly down. Let's go. 1, 2, 3, 4, 5. That's it. Let's do one more and push down. 5, 4, 3, 2, 1, and relax and rest. If you do this over the next 8 weeks, you should be able to lift yourself up off this position. So that is the isometric squat. There are modifications that you can use. You can hold onto something to help lifting you off, or you can start lowering the step progressively over time until you are on a smaller step like that, and eventually you'll be able to gain mobility not only just in your knees but also your hips and your ankles. And there we go, another fantastic leg exercise to help you strengthen your legs while keeping your ankle, hip and knees mobile. If you like this video, please leave a thumbs up. Also, don't forget to subscribe and leave a comment down below to tell me how your exercise is progressing. And if you're looking for an exercise tip to help improve your stair climbing, check out this video. And if you had a knee replacement and still struggling with pain and weakness, check out this video where I'm wearing the same shirt. Thank you for watching, and see you next time.